My name is Vincent Medley. I am the director of the Human Animal Support Services Project, and we are bringing you another webinar, which is powered by the people. And who are the people? You are the people. And believe me, you are always on our mind. And because we believe that all of our work is an industry-wide collaboration, not only inside the industry, but even outside the industry, whatever resource we can provide and bring to our people, to all of us, to all of you, we are going to scour every industry we can to make sure that you have the information and the innovation that you need to do your jobs effectively and to make change within your organization and in your community. So before we get started, in tonight's webinar, which is the crisis sheltering for pets, I am going to review a few housekeeping items. I apologize, my reading is a little off. I'm like Ron Burgundy, the teleprompter got me this time. Okay, so in Zoom, you'll see the Q&A option at the bottom next to the chat option. Please use the Q&A to submit your questions if you have any for the panelists, and we will ensure that your question will get answered. Please use the chat to engage each other and our panelists throughout the webinar. Please, any comments, by all means, anything that comes to your mind, pops in your mind, please use the chat for that. Funny comments are welcome. Engaging comments are welcome. All comments are welcome. We ask that you stay on topic in the chat. This is true. And then also in order to chat with each other, please use the drop down in your chat and switch it to that particular person, or if you want to chat to everybody, chat to everybody. Lastly, a recording of this webinar will be distributed within 3 days to the email that you registered with. If you do not see it in your inbox after 3 days, be sure to check your spam. You can also visit humananimalsupportservices.org /webinars to find past recordings. Now, without further ado, without further delay, let me introduce to you our panel. I will have the panel introduce themselves, but I will, tonight's webinar, once again, is Crisis Sheltering for Pets, Keeping Pets and People and Pets Together. We will have the opportunity to speak with a selection of some incredible experts from across the country that are doing in some cases, some very different things when it comes to crisis sheltering that you can either duplicate in your community or connect with them to find out how they are doing it in the community as well. So what I'm going to do to start off is I'm going to invite the panelists to unmute, and to introduce yourselves. Just start off by introducing yourselves, and then we'll get into some questions. We'll get into some really in-depth topics, and also please, like I said before, use that Q&A to ask any questions, and we will make sure your question gets answered.
I think I'll go first. I got unmuted first. That's me. I am Jodi Polanski. I'm the founder and executive director of Lost Our Home Pet Rescue in Tempe, Arizona. The rescue was started 15 years ago to help people and pets in crisis, and that was back during the foreclosure crisis. Crises have changed throughout the years. Not changed, they've evolved as far as the type of help out there for them, but it went from helping people with foreclosure pets to domestic violence, homelessness, hospitalization. The program we have is our main one's a temporary care program where we care for pets for up to 120 days while people are in shelter, whether it be domestic violence or homelessness, or out of shelter. It could be hospitalization, any kind of crisis in which a pet parent can temporarily not care for their pet. We will care for their pet so they can get reunited when the crisis is done. The program started off as we were all volunteer, no shelter, and got the program up and running that way for many years. We evolved to a small shelter, and then now we have a 12,400 square foot shelter in Tempe. Most of our temporary care pets they stay in foster homes. We have a big foster network, although our shelter is used mostly for our adoptable animals because we do adoptions too. And we also do a pet food bank. So Vincent came out and visited our shelter, and there's quite a few things he liked about it. He's like, talk about that. So I'll let you let me know what you want to talk about. There's so much about it, but it's the organization has done so much, and domestic violence actually is our expertise. We helped another shelter, a domestic violence shelter, help start up entire pet shelter on their campus. I do a lot of work with domestic violence shelters and homeless shelters, but mostly domestic violence is our expertise. So anything along those lines I can give you a lot of insight to, because we've been doing it for so many years. So
thank you so much, Jodi. And yeah, I did go visit Jodi's shelter, and we'll get into it, and believe me, we'll have plenty of questions from the audience, and I have some questions for you tonight, Jodi.
I'll go ahead. My name is Kristina Pulsipher, and I'm the co-founder and executive director of Ruff Haven Crisis Sheltering in Salt Lake City. We formed we officially opened our doors in June of 2020. So that was a really interesting time for us. We had actually identified the need earlier in the year in January. So we had started preparing. I'd met with Jodi, met with a lot of our organizations trying to figure out how to do this. There weren't a lot back then. I think I could find like 4 on Google. And so fortunately, Jodi was so kind to share a lot of her documents and things like that with us. And so we operate actually out of a boarding facility as well as foster homes. So one of our co-founders and our operations director owns the boarding facility. And so that has been really great. So I am a licensed social worker as well. And we now have expanded a lot of our services into all kinds of pet retention. So we do direct outreach to homeless encampments. We work a lot with the city, Salt Lake City. We provide vaccines, all of that kind of stuff. And we just started a mobile pet pantry with DoorDash in November. So yeah, all kinds of stuff that we're doing.
Thank you so much, Kristina. And Andy.
Absolutely. Thanks, Vincent. My name is Andy Bond. I use he, him pronouns. I am the co-founder of BestyBnB, which is the technical platform that enables social services and animal welfare services to find short to long-term temporary housing for the pets of the clients that they serve. So we work with domestic violence agencies. We're currently working with 11 domestic violence agencies, 3 mental health centers, and then 1 animal welfare center, specifically with their outreach team that works with the houseless community here in Kansas City, Missouri, where we're based. We're relatively new to this space, and we've been very warmly welcomed. It's such a tight-knit community of people that are trying to help pets and people that we continue to learn every day, every week, how we can improve our platform to enable agencies that are providing those direct services just to better serve their clients and their clients' pets by removing barriers to safety and services. So that's a little bit about us. We're currently in 3 states. We have shelter partners or agency partners in Missouri, Kansas, and Oklahoma. And now that we've spent the last several months kind of building a blueprint for how this platform can work in communities and serve as a hub for social services to collaborate among one another, as well as a hub between animal services and social services, we're really excited to be moving beyond kind of our 3 states right now, and just trying to help have an impact in as many communities as we can. So certainly appreciate the opportunity to be on this panel with so many experts, and to communicate and connect with folks in the audience to see how we can all be small pieces of a bigger effort to try to remove barriers to services. So thanks for having me.
Thank you so much, all of you. And as you all see, we have a variety, a good variation of experts that, whether it's software, whether it's nonprofit, that can answer a lot of your questions. So please ask questions as they come up for you, and put those in the Q&A. So I wanted to start off with this panel because to talk a little bit about the origin story of your program or your organization. Like, how did it start? Where did it come from? What's the mission? Why, and how all of that relates to crisis sheltering.
Yeah, I can jump in with that. I'm going to introduce myself real quick too. I'm Shoshana Mostoller. I'm the Community Engagement Manager for the Chesapeake Humane Society. So we're located in the Hampton Roads area of Virginia. My organization started 50 years ago and has primarily been a low-cost veterinary clinic, but we also did have an adoption program. We just last January opened a new facility, well, a year ago, January, opened a facility where we have on-site space for crisis boarding. And we also provide some of the wraparound services that were mentioned earlier as far as the pet pantry and things like that. And I also come from a social work perspective. So we do try to use trauma-informed care in that perspective when we're dealing with our clients for the crisis boarding. As far as what drew me to this, which I think is the question that was most recently asked, is I had been working at a shelter in Illinois, and then my family moved, and I knew at that point I was not using my social work skills. I was working as an executive director, and I just knew I really wanted to get back to my social work skills and back to working with people again. And so it's been really exciting to get to the organization where I'm currently working right at a time when they were already thinking about starting a program like this. So it's been just wonderful to dive in with that and be working with people and, helping keep families together. So that's, that's my origin story.
Vincent, you are muted.
Okay. So as far as I wanted to just follow up with you real quick, Shoshana, because you and I have talked several times and I know a little bit about your story. Talk a little bit about how this program came into being in your organization. Yeah,
no, absolutely. So when we were moving into the new, this was really, the idea of it started before I joined the organization. The executive director had already been planning to start a program like this. I don't think we realized how big it was going to grow as quickly as it grew. So when I was really lucky that I already had met her when I moved and had a meeting, and we just discussed what the plan was. And so I got to kind of develop everything from the beginning, which was really exciting. And then, once we got started, like I said, it just keeps getting bigger and bigger. But the idea was already there, but I don't know if we had an idea of what the need was, but it's definitely been growing really quickly since we started.
All right. Well, thank you. And who's next? Tell us your agency's origin story.
I'll go. So as I kind of mentioned, we had started looking at this in January of 2020. I'm a licensed social worker. I was working in the criminal justice system with adults, actually. And so I was seeing clients and stuff who couldn't go to court because they were unsheltered and had their pets with them, or they wouldn't go to jail, or they wouldn't go to treatment appointments or things like that. And so I met my co-founder, Marissa, at other animal welfare events. I'd been volunteering at our local Humane Society and in a group that provided supplies and so forth to the unsheltered community. My little dog wants to say hi. And so talking with Marissa, she just was kind of doing some stuff like this on her own, being in a very transient sort of area, boarding facility in downtown Salt Lake. So we just kind of were doing this separately. And so we suddenly just kind of saw the need and decided with two other co-founders who had worked with another organization that we wanted to try this. So really what we did, honestly, is we really started just by reaching reaching out to whoever we could find to talk to about this, because we definitely didn't know what we didn't know, and we wanted, so they put us in touch with Jodi, and then we talked to all of our local animal welfare organizations who we had relationships with. And, you know, so I've got the social work background, she had the animal services background, and that honestly, that has really been very impactful. I'm sure Shoshana and Jodi can attest to this, that this kind of programming is very human focused. It's very heavy on interacting with people. So the case management and that piece is extremely important with this. So, but I love it, and it's fantastic. And I'm not a burned out 20-year social worker at this point. So this is kind of just, yeah, what we love to do.
Thank you, Kristina. And we'll talk a little bit more about social work as part of this and where that fits in, because I think it'll be a really eye-opening for a lot of our participants tonight. So thank you for that. Who's next? Yes, Jodi.
I'll go next. When I mentioned my background, actually, I used to do mortgages, and I was also volunteering for a pet rescue. I kept hearing the stories of pets being abandoned in foreclosed homes. This is back in 2008 foreclosure crisis. And so my initial idea was to help people who were lost their home to foreclosure and help the animals that were being abandoned. But after I started the rescue, immediately I was getting calls from pet parents who didn't want to lose their pet. They needed someone to care for their pet just for a couple months while they're staying with a family member till they get back on their feet again. And that's when the temporary care program started from there. But then once the program started, I started a lot of phone calls from people who are trying to leave domestic violence situations, or they were homeless, whether it be sheltered or unsheltered and needing help. And some medical. So everything sort of snowballed from this foreclosure crisis that was about, because a lot of the types of services that you can help somebody for that is the same thing for any kind of crisis. It's also how the food bank was born, because people would call me up and they were asking just for some food because they didn't want to lose their pet because they couldn't afford pet food. So everything kind of came honestly from the phone calls that I was getting, because I didn't know at the time what that need was. I knew animal rescue through taking care of cats, So I learned a lot along the way. Thank God I've had a lot of wonderful people in my life that have helped build this up. But we started doing these programs out of the need from the phone calls. And the domestic violence one was definitely one that I had no idea of. The first person who helped us run that program was a social worker. So the program was up and running pretty well with her. She was a volunteer, and she really made a big impact in how the program worked. And as of today, we have social workers that work in that program right now. We also partner with other social workers and other agencies, because the social work component is critical to them getting everything back together again in their life and getting their pet back. So we've learned over 15 years, the more support they have, the more likely they're going to get their pet back. And so I'm not a social worker, but I've got great people around me that have taught me how important it is to have them. So.
Thank you so much, Jodi. And Andy.
Yeah, it's a lot of the stuff that Jodi was mentioning really resonates with our backstory. My co-founder and I come from completely distinct backgrounds. Matt is a filmmaker and a writer and a creator and technologist at heart. He worked in Sundance. He worked for Robert Redford and ran the art department for the Filmmakers Labs out in Utah after we left undergrad. I went a little less creative route and went to law school at St. Louis University. So I am a recovering attorney. I hope it's not held against me too much on this call. But we went distinct ways for the first parts of our career. Always maintained a close friendship, always tried to help support each other. And then in 2013, we had the opportunity, I was leaving private practice. We had an opportunity to co-found a company that built a very large piece of software for the entertainment industry. And so we spent 6.5 years doing that, which is really where we learned to build very large, very secure software that had to be very user-friendly, because we were working with, on one hand, the studios like NBC Universal and HBO and Netflix, who all they really cared about was making sure that their proprietary information, like shooting script and actor fitting photos and the like, didn't get leaked. But then the onset filmmakers weren't going to take the time to use a piece of software if they felt like it was something they had to learn. So we did that for 6.5 years. We were looking for another opportunity after that software got acquired. We didn't know what that was going to be. And then Matt called me one day. He was listening to our local NPR affiliate, and there was a person from a local domestic violence agency that was their director of housing and the director of grants, talking about the biggest barriers that their agency faced. I happened to be listening to the same episode, so when he called me and had pulled over, we both just listened to it together, and that's when we learned that pets presented a barrier for survivors seeking safety. And when they were mentioning some of the stats, like 50% of the time that a person calls a crisis hotline and finds out they can't bring their pet, they hang up the phone and choose to stay in an abusive situation rather than abandon their pet, because 70% of the time in that scenario, when a pet is left behind, that pet is harmed or worse. Those are things that we didn't know. Didn't know that was a thing, let alone the level of crisis that it was. But the minute we heard it, it made complete sense. And the more we talked about it and started kind of talking about how maybe we could come at these barriers to help be part of the solution by utilizing technology, the more kind of momentum picked up in that conversation, to the point where I ended up driving out to his house that afternoon. And we started creating a storyboard of how we would envision a platform functioning from that crisis hotline call all the way through to reunification with the pet. And the more we got into that, the more we felt like we had something. But we also, we knew that it didn't matter what we thought. We needed to find out what the experts that were dealing with this day in and day out, what they thought. So we started with the person that gave that interview, as well as the CEO of that organization. And the short version is we were on a tour of their facility. We saw the children's play area where they had kiddos from infants all the way to the oldest teens that they would allow to be in shelter. And just knowing that those kids were at that moment separated from the parent that they fled violence with, and also likely, statistically also removed from a pet that was probably one of their only sources of real stability. It really just kind of stopped us in our tracks again, to the point where in the parking lot after that meeting, we committed to setting everything else we were working on aside and making this our full-time mission. We knew that if we were going to undertake building this platform, we had a responsibility to get it right. We knew that we needed to build a platform that worked the way that agencies and advocates would need it to work. And in order to do that, we needed to really understand not only the breadth and scope of the crisis, but also how agencies worked and how they would need that platform to work. So fortunately for us, our spouses were extremely supportive in that commitment we made to each other when we got home and shared that afternoon, because they allowed us to take the risk to spend a little over a year just traveling all over the country, meeting with experts in domestic violence advocacy and pet advocacy. And so we really refined our understanding, created requirements of how the platform would need to work. That's when we learned that this barrier wasn't unique to folks experiencing domestic violence, but it was a barrier to mental health treatment, substance use treatment, primary health treatment, housing, insecure, houseless population, the veteran community, all of these folks that were trying to seek services that wouldn't do it if it didn't mean that they had a safe place for their pet. So we started building the platform, and this resonated too, right at the start of right before COVID kind of shut everything down. One silver lining there is it enabled our development team to actually be kind of bolstered, because our development partner wanted to keep their folks busy and happy and there. And so they increased the number of people working on our platform, which shortened our development cycle by about 7 months, meaning we were able to get it out and get it in use sooner than we expected, and let it start having that impact. And one of the things we were very intentional about was building something that could be used by an agency that had no prior pet advocacy experience. But we also felt equally compelled to make sure that those agencies that were already engaged in pet advocacy and doing that wonderful work for their clients, that we could enhance the services that they provide. So I can't imagine doing anything else. It was the greatest serendipitous moment of both of us hearing that interview and being able to kind of plant that seed. I mean, I should say the greatest scenario would be we get put out of business because there's no need for our platform or or these types of services. But knowing that that's not going to happen anytime soon, we're just very, very fortunate to be working among the people that are trying to help solve these issues. So we came at it from a little different angle, but it's something that gets us up and drives us every day.
Thank you, sir. So let's talk a little bit about the people that are that you encounter, and I'm going to kind of roll a couple of questions into one. And keep in mind, we do have quite a few questions from the audience. But I wanted to talk to you about the type of people or the type of crises that people are typically coming to your organization to have that you respond to. And to add to that, what are the one of our anonymous questions is, what is the process for accepting pets into temporary care? Is there an application, and is there ever a time where you feel like, how do you respond to someone who says, well, there are some people that are taking advantage and they really don't have a crisis? But talk a little bit about your clients and your process.
Oh,
No, you go, Jodi, and I'll go after you.
So we do have an application process. You have to have that, and for many reasons, but for one is you know, as Kristina knows, you'll get inundated very, very quickly, and you have to be able to go through and find out, you know, you can only take in a portion of the people that are coming to you for help. So so you need to be able to, like, for us, we're going to go through, we'll actually look at the application, and then we will give resources to people that we can't help. Before we take them in, before we set up an appointment, we would come in, we're going to talk to them on the phone, we're going to get more information about the situation. You know, we're able to help the people who are kind of the worst of the worst, because there's not a lot of room to help more than that, really. There just isn't. So, you know, that's why we do a lot with domestic violence. We look first to see if there's a person and a pet that's in danger, and that's always our priority. That could be domestic violence. It also could be homeless, unsheltered. So that's where we do a lot of focus. And it also could be, you know, medical, where they're in a hospital and they're going to check out because there's no one to care for their pet. So there isn't really an opportunity for people to take advantage, because there's so many people coming in that need help, and you're going to really try to help the ones that need the most help. And you're going to find that out, not just the application, but talking to them on the phone at the same time. So if that answers that question, that's how that process works. So, you know, and on top of that too, we have to do an evaluation, because we still have to be able to care for the pets safely. So we are looking for behavior, and we're looking for medical to see if these are pets that we can medically care for, and if these are pets that we can behaviorally care for. So there's a lot to it. It's not a simple process, unfortunately, but it helps us give the help to people that need it the most, and the ones that we can have the best impact on. For example, one of the questions we're going to ask is, what do you have in place to get yourself remedied from the situation? If they don't have something in place, are they working with somebody? Do they have a social worker? Do they not have a social worker? You know, when they're working with a social worker, we know that there's a much better chance they're going to be able to get through their crisis and back to their reunification time with their pet. If they're not, are they willing to work with the social worker? So those part of the application process is going through a very thorough conversation with them, including that. So, and the types of crises we deal with, you know, I said mostly it's going to be domestic violence and homelessness and medical. Of course, you know, veterans with PTSD, we do work with them. So inpatient treatments, it could be addiction, you know, or it could be, like I said, PTSD. There's so many times people are they're right there and they want to get help. And they just need someone to care for their pet because they won't go into that facility to get the help they need unless there's a place for their pet to go safely. And you can really turn somebody's life around by caring for their pet for them, so they can go in for addiction help or whatever their situation is. So, but there's not a lot more you can do besides the medical, domestic violence, and homelessness because the need is much bigger than we have the capacity to take care of.
Thank you, Jodi. And it's so significant, and it's a different approach in many ways, because most of the time animals enter a shelter because there's a crisis that has to do with that animal. And this is all people oriented, where the person is in the crisis and there's a need for the animal to enter the shelter because of that. All right, who's next?
Yeah, I'll jump in. Our process is very similar to Jodi, so I'm not going to go over all those things. We do a very similar process. There's an application. I talk to people on the phone first. We do an evaluation to make sure we can handle the animals. It is important to remember that the people are in crisis, but the animals are too. So lots of times by the time the animals come to us, they might have already been living in a car, in hotels, been shuffled from place to place. So, it's just important to keep in mind that the animals are also going through trauma. As far as determining who's appropriate or not, I really try not to look at it as wondering if a person's deserving of it. I feel like if someone's reaching out to me, then they're in trauma. And it's lots of times, like Jodi said, you can case manage some of these to where they don't even need to come in. Maybe when you talk to them, there's other services that you can provide. Hey, if we provide a crate, if we provide for supplies, there's ways that you can sometimes work with people where they don't end up, after you have that conversation with them, they don't end up even having the need anymore to necessarily do crisis boarding. But I definitely try to come from a perspective of it's not really my place to judge. I mean, we have a dog with us right now whose owner is in jail. It's still a crisis. That the dog still deserves to be with its owner, and that owner still deserves to have its dog. So, that's just my perspective on that.
Yeah, I'll just tack on to what Shoshana and Jodi have said. We definitely also, I think Shoshana talked about being trauma informed. I'm a trauma informed facilitator. That's a word that we're now starting to hear a lot of in animal welfare. Vancouver Humane has an amazing animal welfare based trauma informed training that is 100% free. I can't stress that training enough if you're looking for that. But we definitely go without judgment, but we do have to make eligibility decisions. I was just at Expo, and some people were with us and they're like, your phone is out of control. And we're like, we know. I mean, it is just nonstop. And so, we're getting probably 7-8 applications a day. We just cannot manage. Awesome. I'll have to put that in there. That sort of level. 50% is probably, I think 50% of our clientele is housing insecure, and then also domestic violence, things like that. So I would just look at really, really partnering with your human service providers in your community. In fact, I literally just last night sent in an application to become a homeless management information services provider for us, which is a federal homelessness facility that shares data across human welfare organizations. And so that's where we're really going into. I'm speaking at a domestic violence conference this week on Friday. So, really partner with them. We're in a fortunate position in our community that our homeless resource centers allow pets. And so, we tell people that unfortunately homelessness in and of itself is not a crisis for us. If you're allowed to have your pet with you, then we will give you kennels. We will do any of that kind of stuff with that. But again, if you notice, we all have social workers in our vicinity. So we're kind of able to maybe use some of those questionings and motivational interviewing skills and things that, what is your plan to reunify in 60 days? If they're, or 90 days, or, whatever, if they really don't have anything and they're just kind of Society, that's just not a family we're going to be able to serve, because there are so many other families that are in need. So that's definitely the hardest thing about this, is to turn down all families in need. And we kind of have to say we are a crisis program, not a really crappy, sucky situation program. And there are a lot of those, right, where they're moving and the lease is up and they couldn't find another place. That is difficult. But, you know, and we're talking about people whose families have died, or they've lost their job to COVID, or they are in domestic violence. Unfortunately, those are gonna take precedence for us. And so I think, again, we've just kind of monitored that. So I cannot stress enough, if you don't have someone that has social work experience in your organization, look at students, look at schools, at least have people that like people. That's the other thing. It's, you know, that is good with people. We have a lot of animal welfare people here, and just, you know, kind of navigate that. So.
You know, and while I have, no, that's very important. So Andy, I wanted to ask you, in reference to this question, what type of agencies does your organization partner with your software?
Yeah, that's a great question. We are currently working with domestic violence agencies, mental health centers, who work across the spectrum of different services they provide, from psychiatric care to substance use to different types of physical therapies. And so it's much more broad than oftentimes when somebody hears mental health center. The services that they provide are more broad than oftentimes folks know. And then one animal welfare agency that has an outreach team working with the houseless community. And so while we don't provide those direct services, you know, the experts that are at the agencies that are doing that day-to-day work, we're trying to build tools, or we did build tools to try to help alleviate some of that workload and that chaos, to try to make things a little less time intensive on the advocates end. So being able to quickly create a client profile and then a very robust pet profile, just in the event that person and that pet does get accepted into the program. The advocate and any administrator that at that agency that has access to the BestyBnB platform can quickly see, okay, has that animal been has it experienced abuse? You know, all things like, you know, age, approximate age, breed, if they know it, you know, weight, all those kind of things. But then all the way down to, you know, do they get along with children? Do they get along with other animals of all types? Are their vaccinations up to date? Do they have any special medical needs? All of these things that just kind of help paint a picture of that pet, just in the attempt to try to make sure that the agency and the advocates are able to find the best place for that. You know, sometimes animals are going to be well suited to a shelter environment, or they might need some extraordinary care based on the trauma that they've been exposed to. There are other animals that might be better suited for a home environment. So we just want to provide multiple options to make sure that pet is getting into the right spot. And then the thing that I loved about all three prior responses, in addition to the fact that it's just all direct service related, is that human animal bond was a part of all three answers. And that's something that we were very intentional about taking into account for our platform, and creating a tool where that client that's receiving services and the person that's caring for their pet, regardless of who it is, without them knowing one another's identity or location, they can anonymously and securely communicate about that pet's care. So they can receive picture and video updates. They can still be engaged in that pet's care if it's not eating well, or you know, whatever day-to-day issues come up as pet parents, they can still be involved, and that really helps keep that bond in place. And we found that it also helps make sure that that reunification rate stays as high as possible, because they are still engaged with their pet.
Nice. And, you know, so I wanted to talk to you all just, because we know this is all about people. And I know that, in our work, in our industry, there's always cases that stick out in our minds as just ones that really, that really stick with us. So talk to us about a little bit about what, just a case that you felt like really just had a huge impact on you. And then also, what would that person or any of your clients do if you didn't exist? Where would they go?
I'll start. Oh gosh, there's so many, so many amazing clients. And if anyone else has heard me speak, I talk about our clients as animal welfare heroes, because they're doing heroic things as well that are sometimes behind the scenes that you don't hear about. We always are constantly hearing about these animals that get dumped and they're doing that. You aren't going to hear about the animals that are doing significant sacrifices to keep their pets with them, right? Because it's prevention. So we're really big on storytelling on our organization, all with consent, of course. We have a very robust that we got from Jodi, actually, for photo consents and to share stories and things like that. And we, talk about what they go through in order to keep their pet family with them. So, one that honestly stuck out with me, it was a family that was traveling through on vacation, and they were in a significant car accident, lost their teenage son, and their dog got impounded basically at the shelter. They were from Texas. They were coming through to Yellowstone. They almost lost, it was almost stray holed up and almost lost. They got in touch with us right at the very end, and we took that dog. And they stayed in touch with us. They shared us, like their celebration of life stuff, and really like they didn't lose that other family member. So, we just talk a lot about, like, we do not say pets, or animals are better than people in our organization. If you look at any of our merch, it's all both ends of the leash. Pets, cats, dogs, people. Again, people is integral. I cannot say that enough to who we do that, who we serve. So we just really are always very, very positive when we talk about this kind of work.
I could probably talk stories all night, but I won't. But going back to the relationship building, I think my favorite stories are the ones where multiple organizations got together to help make this person's success. So, for example, I had one person that I was working with who had put her cat into a boarding facility and had been putting so much money towards the boarding facility that then she couldn't save money for her own housing. And so by the time she called me, she already owed them, quite a bit of money. And so we worked, like, she gave them her last little bit of money, and then I worked with the boarding facility and they agreed to lower the cost. And then we were able to find some money from a grant to help pay for the rest of it. So you see organizations coming together, all with the goal of keeping the animal with the family. We've also had really great luck partnering with some of the animal control facilities in our area. So, we had one person who had used our program, and the dog had left the program, but then she found herself in a pinch again, and she did not reach out to me right away, but then did reach out. And by the time she reached out, her dog was already, she was getting ready to surrender it to another facility. And then she called me, and I was able to work with that animal control facility. I didn't have space right at that time, but I knew I was going to have space in 2 days. So they were able to hold the animal for 2 days and then have the animal transferred to us. So I just love the stories when people are all working together from different organizations to really help people to realize their dream of keeping their pet with them. I just find it really inspirational.
Well, and none of us can do it alone. And I think a lot of times animal shelters feel like or animal organizations feel like they need to. And you're right, it's a team effort.
So I'm trying to think, the same thing as everybody else. There's so many stories. So, but I think that the one of them that probably is in the forefront of my mind at the moment, so you said that, I was working one day and the shelter, and this lady came in with 2 big dogs, crying, hysterical, 2 black eyes, and had just been, badly hurt by her abuser. The police department were there. The police told her to come to our shelter. for the animals. She had not left because she didn't know where the animals could go. But the point that at that point she was like, I just need to go. I need to get out, because he was going to kill her. So she left. She had the shelter. She was right that moment, like we were with her before she went any place else. She went to our shelter with her dogs, and we were able to get her into a domestic violence shelter and take the dogs into our program. But just the I've never been on a ride along with the police, and so I usually don't see that part of that. I see crisis, but not when it's just happening. And so that was why I think stands out for me a lot. There's a couple like that where the first place they went was our shelter with the animals. They didn't know where they were going to go. And that's what I always remember. One time, I was doing a news segment in the front lobby, and I saw a dog running loose in the parking lot. And so I ran out there really quickly, like, why's the dog loose? I said, lady coming out with her little son, and she's crying, and she's telling me she's left and she's got to surrender her dog. She can't take her dog to whatever shelter she's going to end up at. And so the news segment, the cameraman was there, and they stopped filming because to give this lady her privacy, and she came in and we got her in our temporary care program. But it's just you never know what's going to happen from a day-to-day basis, whether it be crisis happens like day or night, and so I think those are the ones that stick out to me, like right after something happened, and they're coming first to us before any place else, before the hospital, before any place. They're going to us with their animals, because their animals need to be cared for. That's what's important to them.
I think that's so important to bring up, is like I have found that a lot of people do come to me before they've ever reached out to any human service organization, because really their animal is the first thing that they're thinking of. And so that's why it's also so important to build those relationships with the human service organizations, because at the end of the day, you're going to be able to connect those people with the services that they need to not only get their pet back, but to also be successful in finding a place to live or whatever their emergency is. So it just reinforces that you can really also help them on that end.
All right. So, okay. So real quick before you go, Andy, we have about 12 questions and we have 10 minutes. And I want to get to as many questions as possible. So make sure. So now we're going to do rapid response. Keep your answers as brief as possible.
You got it. This will be real short. My favorite story from BestyBnB is our first pets that were placed. Matt and I were convinced and just certain it was going to be a dog or a cat or a pair of cats, or it was 6 therapy turtles. And we have permission to share this story, but person came into a domestic violence agency. I'll spare the details. There were more turtles before the person got there. But a BestyBnB pet caregiver took those turtles in, built them a new habitat, kept them for 64 days while that person was receiving treatment, and then delivered the turtles in the new habitat back to the advocate, so the advocate could then safely and anonymously deliver the turtles back to the client. And so that's still my favorite story we've encountered.
Nice. So we had a little bit of questions in the chat about social work, and there's a 2-part question here. Number one is, what part does social work play in your work? And also a question from Kathy Jansen, which is, she's curious about the new field of veterinary social work. And are there degree programs out there? Does one also need a DVM as well as an MSW?
I can field that. There are several places that have veteran that specialty, or if you're already a social worker, you can get the certificate like I'm getting. But there's also for those, and you do not need to have the veterinary side of it. The veterinary social work certificate and also the programs where you can get your degree in that are based on the social work side of things. But there are also for people who are trying to, so you have to be in some type of mental health field to get like the post-grad certificate. But in terms of if you're more working with the animals and you want to get that human side, I know the University of Tennessee has a different certificate program that's based towards people who don't yet have a mental health degree or background, but you still learn a lot of those same skills. So that's worth looking into as well.
I was just going to add really quick. I mean, someone asked this question that, you know, if you don't have social workers in your facility, which a lot of people don't, right? It's animal welfare. I don't think it's a bad idea to only take in animals with a social services referral from your, to have someone screen that for you and make sure it's appropriate. So if this is feeling really overwhelming, sorry, my dogs are of course now being crazy and playing, but is to go that route. And it's okay starting with something, right? Just if you can't start huge, start micro level and start with, you know, those human service referrals.
And I don't think we realized how important it was to even just have a separate staff member to be like running this program. It's not an easy program to fit in with other stuff you're already doing, right? Because it takes a lot more work than just a few phone calls here and there. Like to actually do case management is work intensive. And so I think a social worker is great because you know how to have those conversations, you know how to, like, you've already had that education. But if not, I love the idea of already working with a human service organization and a case manager, but also just consider that you're going to need a staff member to manage this, and it can't just be an add-on to an already overloaded person who doesn't have one more second to add on, because it does take a significant period of time to manage the cases and programs like this.
So I have another question, and I'm gonna ask 3 questions in one. Number 1, how is your program funded? Number 2, what is your yearly intake of people that you support? And then also, what percentage of animals that you take in end up not being reclaimed? And how do you handle that situation?
I'll start really quick. So I am day 10 into my full-time Ruff Haven executive director career now. So this was an all volunteer organization. We actually just got significant funding from our state legislature, which does not happen. And we really minimally talked about animals. It was a lot of domestic violence and with that. So grants, private funding, things like that as well. We take in about 350 animals a year. We typically have 50 to 60 in our program at any given time. And then our RTO, return to owner rate, is 86%. So it's pretty high. When we started this, we were hoping for 75%. So that was when we knew we were kind of doing okay. And then we do assist with private rehoming, which we still consider a successful outcome. And then we have that very small amount of people who do not communicate with us anymore, and then we work with our local Humane Society and best friends to take in our pets for us. So
I'll jump in really quickly. So most of our funding, it does come from different various grants out there, but this is also a program that people love. So when it comes to trying to fundraise, it's actually the easiest program to fundraise for, because you're helping people and pets both, and it's also very unique for a lot of organizations to do that. So the funding is not as much of an issue as running it, honestly. I mean, the funding is an issue. I shouldn't say it's not an issue, but it's harder to get funding for adoptable animals as it is for a temporary care program. I'll leave it there. So our annual intake, you know, it's varied over the years. Our highest year, I think we had like 400 animals in our temporary care program. We typically have about 1,700 animals in our organization that we care for just through the shelter, but not through food bank, not through referrals, and of them 400 is for the temporary care program. And then we've been averaging about 87%. So we're right in line with Ruff Haven, actually. And I gather to think it's probably because of the weekly check-ins that you're doing is why it's so high. And so, because that's what, you know, it needs to happen. It's a lot of work, like they were saying, so.
Yeah, and grants, community grants especially, are great because lots of times they're a little bit less restrictive in how you spend them. So if you have community foundations, I would reach out to them. I think last year was our first year. We had 60 animals. We've already had, as of today, 37 animals this year. So we're probably going to double our intake this year. And we're right at 30, I mean, we're right at 86%. But I also have 3 dogs going home this week, so yay. So I think, I mean, that's probably it, actually. That's probably the answers to the question.
For us, we're a little different. You know, we're a privately funded organization. However, we do partner with our agencies to help them access additional funds from various sources, whether it's community or federal or state grants. Donor engagement, we provide a digital packet for community and donor engagement. We have one agency that ran a capital campaign based on their pet advocacy through BestyBnB last fall and raised $150,000 based on the inclusion of pets in their offering. And then we are also working to obtain corporate sponsorship for both monetary as well as donations for hard goods, dog food, pet food, just different types of things that agencies will need for pet advocacy. Our agency partners have provided over 1,000 safe nights in just the last 3 months with 100% reunification rate. We know that rate will not always be at 100, but while it is, it's something that we're very proud of. I mentioned the tools that the platform has to keep that human-animal bond intact. It also provides documentation for the agency when they have a client that they bring in and they're going to place their pet, that it's a waiver, it's a release of liability for the agency, but it's also an affirmative grant of authority for that agency to act on behalf of the pet in the instance that the client is either unwilling or unable to do so. So what that does is it gives them the authority to implement whatever rehoming policy and procedure works best for that agency. They've got the documentation that allows them to do that. So when that time comes and reunification isn't possible, we just try to put our agency partners in the best position possible to do whatever works best for them.
All right, so we are almost at time, and I have one last question. I know we didn't get to everybody's question, but we will make sure that all of these questions get answered. Oh my goodness, this has been such a great webinar, and I'm so honored to be part of this webinar with you all. Okay, so the last question is, if you could give one piece of advice to someone who is looking into going into crisis sheltering for people and pets, whether it's starting their own organization or a program within their organization, what would it be?
I'll go first. Start small. You have to start small. We started, and same with Ruff Haven, there was no shelter, there was no employees, there was all volunteers, all fosters. Just start small. So whatever you do, even if you save one pet family, keep them together, then you've started the program and you work from there. But that's my best advice, is start small.
I just
better than that. Yeah, that's perfectly stated.
Do what you can. Just don't try to, do too much and bite off more than you can chew. Just even if it's only DV, if it's only hospitalization, just do what you can.
Yeah, and I would also say be very honest with people about what you can and cannot do as well. If you can't help someone, you can't help everybody, but make sure you're very clear with people about what you can and cannot provide.
And I will say that starting small and not being afraid to ask for help, because I've found that this community, there's someone out there that's experienced that issue or something like it, or is really good at problem solving. And I've found that they're more than willing to help. So I would encourage just to do outreach and start small.
One last thing too is I would also work with get referrals from social service agencies first, because then you know that support's already there for the client. So if you can start it that way too, those referrals would be a great way to, whether it be domestic violence or homelessness or hospitals, whatever it is, getting those kind of referrals would be a great way to start it, because you have that support already built in. So.
All right, thank you so much. One of the greatest lessons I've learned, especially when I go to an expert and ask them about their program, never ask where they or ask them to tell you how they started, so that you learn how they built their program from the ground up. Thank you so much. Such a distinguished panel. The chat has gone crazy. The questions have gone crazy. It feels like we need a part 2 of this. Also in the chat, I see It's Raining Cats and Kittens. That is our next webinar on April 27th. So please feel free to register, reach out to Haas. Like I said before, we are powered by the people. And who are the people? You are the people, and you are always on our minds. So please, by all means, reach out, go to our website, sign up to be a partner organization, and look out for more information and webinars from the Human Animal Support Services Project. We love all of you, and thank you for joining us tonight. And thank you, panelists. And I'm sure I will be in touch with all of you soon.